Are not good. More than 1/3 of adults, or 78.6 million people, are obese. One way to combat obesity is to have gastric bypass surgery, something that more than 200,000 people have had. To talk more about this surgery, Dr. Steve Scott is here now from HCA Midwest Health. Thanks so much for coming in. First off, a new study came out and it kind of talked about the benefits that people have seen who have had this surgery. Tell me a little bit about that study.
Yeah, so this study comes from the Cleveland Clinic, a very reputable place. And the thing about this study is it tells us some things that we sort of confirmed and already knew, but it also gave us some new information. And that's always nice when a study does this. This study looked specifically at diabetics, and it compared diabetics who had weight loss surgery versus diabetics who did not have weight loss surgery. And the bottom line is that they had a significantly less risk of having some type of a major heart event, like a heart attack or heart failure. And some of these findings were really remarkable as far as how much it actually reduces the risk of these things.
And is those risks are reduced because these people are losing a lot of weight, right?
That's correct.
Right.
Yeah.
Okay.
So, and they not just losing the weight, but keeping that weight off. And so that was one of the really great things about this study. It followed patients out for up to 8 years after their surgery. And so we saw not just the short-term benefits of the weight loss, but the sustained weight loss and the sustained benefits of that weight loss.
Mm-hmm. What do you recommend to people that are thinking about surgery? And why would you tell someone who is obese to get this surgery? Why can't you say, hey, just go to a gym, just eat better?
Sure.
Why is surgery a solution?
Well, two reasons. Number one, it's important for everyone to understand that this is a disease. It's a disease we don't understand very well. We don't understand really what causes the disease, but it's a disease of the excess body fat content and the effects that that has on all the other systems in your body, like your heart and your kidneys and your blood pressure and things like that. And then the other aspect of this is the reason we do surgery is because surgery works. It's really the only solution for patients once they have reached a certain weight that actually has been shown to lose a significant amount of weight and keep that weight off in such a way that it's going to improve their health. And that's why we do the surgery. We don't do the surgery to make people look better, although oftentimes they do, but we do the surgery because it drastically improves their health.
Yeah, so they're not going to die, essentially. And you were saying real quick, why is this surgery safer now than it was maybe in the past?
So many things have happened, you know, from that point of view, and that's really, of all the things in my career that I've seen the complication rates of the surgery go down tenfold during that period of time in the last 20 years. It's actually safer now to have weight loss surgery than it is to have your gallbladder out. And we have new techniques now that are even less invasive or more effective. And so there's a couple of new procedures that we're doing more commonly now, a procedure called the duodenal switch, a procedure called the endoscopic sleeve gastroplasty, which our group does. And those procedures can either be more effective or can allow patients to have the benefits of surgery, but have less recovery time and less risk overall.
Yeah, definitely things are getting better. Dr. Scott, thanks so much for coming in. We really appreciate it. And for more information on HCA Midwest Health, go to kctv5.com/HCA Midwest.